You're back with us here on France 24. We're live. You're watching Around the World with me, Gavin Lee. We're going to take you live to the Sion Hospital for the press conference there when we're hearing more details about the fire, one of the most deadly fires in the history of Switzerland, La Constellation. We're going to hear from the Director General of the Valais Hospital, Eric Bovin, and his team.
So of the state head of the Department of Health and Social Affairs, Renard Mathias, the head of the Department of Security of Institutions and Sport, the head of the department, Stéphane Ganzer, the Prosecutor General, Madame Beatrice Billot, and the Chief of Police for Valais Canton, Frédéric Giesler. And we have also the head of the Judicial Police for Valais, Lieutenant Colonel Pierre-Antoine Lenin, and also the Dr. Freddy Michel Roten, and also the Director General of the Hospital of Valais, Dr. Eric Bovin. Madam Prosecutor General, I give you the floor. Thank you. Thank you, Lieutenant Colonel. So this is our third conference concerning the dramatic events in Crans-Montana. I thank you for being here in such great numbers for this third conference, which will take place in the following way. We will have the President of the State Council, Mr. Mathias Renard, will say a word on behalf of the State Council. The Chief of Police for the Canton Valais, Frédéric Giesler, will speak of the state of the situation from a factual point of view, and I will tell you with regard to the investigation, and then I will give the floor to Lieutenant Colonel Lengen, who will speak us of the identification of the victims. Then I will give the floor to the head of the department, Stéphane Ganzer. And then Mathias Renard will talk to us about the healthcare situation. And there will be Dr. Freddy Michel Roten will talk to us about the significant importance of the commitment of OCVS Emergency Service, and Professor Eric Bonvard will talk to us about the current situation at the Valais Hospital. Then I will take the floor in closing the conference. At the end of this press conference, as we did for the previous two press conferences, we will answer your questions, and then all the speakers will be here and available to give interviews. I thank you, Mr. President of the State Council. I give you the floor. Thank you, Madam Prosecutor General. Ladies and gentlemen, representatives of the media, I am speaking on behalf in my capacity as President of the State Council and for the Healthcare Ministry. Our government of Valais would once again like to express its feelings and sympathy to the families of the victims and those injured and those who are waiting to hear. And we understand how difficult this time is. It is unbearable with every minute that goes by without an answer. Our teams from the very start have been doing their utmost to save lives, to support families and not leave anyone alone, and obviously to identify as quickly as possible all the victims. And what we see now, we've noticed amazing cooperation that has formed to take care of the victims. The Valais Hospital took about half of the 119 victims and patients admitted. The other cantons then provided enormous support, and I would like to thank them. OCVS Emergency Services will give you details later, but we know that the CHUV, the hospital in Lausanne, took over 20 patients. And we would like to express our gratitude for this cooperation. This solidarity and cooperation did not stop at the borders. Many proposals of support have come from abroad, and especially from bordering countries. Our role as an advisor to the state is to facilitate this contact. And I want to thank the President of the Confederation and all the councillors of our Council of State. We thank you for your support. And an order has been given by the President to have the flags flying at half-staff everywhere in the country, but also abroad. All Swiss flags will be at half-mast. And internationally, we have spoken with Madame Maurice, the French healthcare minister, who assured us of her country's support to take care of injured people, and transfers have already begun toward French hospitals. She also put at our disposal specialized doctors who can help and supervise these transfers, and we are doing this from the Valais Hospital. The Italian Foreign Minister, Mr. Tahini, has come to Crans-Montana. My colleague Ganser and I went there, and they met with the families and the Italian community that has been affected by this drama. And again, there was a proposal to take care of the injured, and this proposal was accepted so that these patients can go to the north of Italy. So solidarity is in action in this drama. And the OCVS will provide more detail through Mr. Freddy Michel Roten. And what we can say is that some 50 patients have been or will soon be transferred to specialized centers for people suffering from major burns. Mankind, humanity has been added to the professionalism of our teams, and we see unprecedented solidarity in taking care of the victims. We are facing a tragedy and a dramatic number of human losses. The latest was 40 people who have died. This is very upsetting, and on behalf of the government of Valais, I want to express all of my sympathy and most sincere condolences to the families for what they're going through. Many injured people are still fighting for their lives. Many people have been taken into hospitals, and their life is still in danger. They are being taken care of by exceptional teams in Sion, throughout the country, and also in neighboring countries' hospitals. After this press conference, I will go to the hospital to support patients and talk to the team, and I want to point out the excellent work by the Valais Hospital. Its administration and management and the medical corps are doing incredible and exceptional work. And we want also to thank their remarkable work. And many people gave up their Christmas holidays in order to support the teams that were on duty. And one nurse talked to me about the silence that was looming in the hospital. And I want to say in conclusion that there will be a ceremony organized in Crans-Montana on Friday, 9 January 2026. We have just informed the Federal Council of this. This ceremony will be an opportunity to gather, to be a community, to be in communion, and to live through this moment of grieving and mourning together. A book of condolences will be made available as of tomorrow, Saturday, on the website of the Confederation to enable all those who would like to do so to convey a message of support, solidarity to the people who have been affected. I thank you. Ladies and gentlemen, yesterday morning, the destiny of about 160 people became a horror in Crans-Montana. Since that time, the police of this region has been working tirelessly to provide answers to the victims and families affected by this unprecedented drama. The first and most important thing to know is that if their loved ones are among the injured or those who lost their lives in this tragic fire. And this is what I can tell you at this point in time, specifying that this information has been conveyed to the families concerned. With respect to the people wounded, there are 119 of them. As far as we know, 113 of them have been formally identified. With regard to 6 others, procedures for identification are still underway. Among the wounded, formally identified, there are 71 who are Swiss, and we know that there are 14 French nationals, 11 Italian nationals, 4 Serbs, 1 Bosniak, a Belgian, 1 from Luxembourg, 1 Pole, and 1 Portuguese person. Among them, 14 of them, we still do not know from which country they come. And I want to say that all these figures will change as we advance in the identification process. With regard to the people who have deceased, as said by the President of our government, we now know there are 40 deaths. Their official identification is underway. It is our priority to identify these people as soon as possible. We have the necessary means to do so, and we can count on the support of many specialists coming from various canton police services, and I thank them. But the formal identification process, standardized at the international level, takes time. And to do this, there have been some ante-mortem cases, and procedures have started with Switzerland, Italy, France, Portuguese, etc., and Serbia, Turkey, and Indonesia, and the Philippines. These procedures will enable us to have a final and formal identification of these people as soon as possible. And the Valais police force, through me, would like to reaffirm its tireless support to the families so hardly tried by this horrific incident. On top of investigation and identification and protection missions, I have ordered that each and every one of these families be followed, if they would like to do so, until the people, people who have deceased can be formally identified. We want to support them in this period of suffering and uncertainty. Finally, I would like now to address my most sincere thanks to all the police corps and committed partners who have been part of this operation. Thanks to their mobilization, which has been perfect and tireless, we were able to take care of the victims as soon as possible and begin the identification work. This is work that will go on, as you know, in the days to come, with full commitment. Now, with regard to the initial results of the investigation that has been conducted by the Minister of the Council of State for Valais, I give the floor to Madame Béatrice Piou, who is our Prosecutor General. Thank you very much. Thank you, Commander. With regard to the investigation itself, I want to assure you that the public ministry is doing its utmost to get to the bottom of this dramatic event. As far as I know, an investigation was opened today to get to the bottom of the circumstances of this fire. Everything and all tracks are being explored. None has been ignored or neglected. Among the hypotheses, some are being confirmed. Indeed, everything leads us to believe that the fire began from candles or sparklers that were put on champagne bottles, and all of this was placed too closely to the roof, or the ceiling rather, and that's when there was a flashover that took place in this establishment. To arrive at these results, there are videos that were obtained and analyzed. Several people have been heard, and there were statements made on site. In the hearings that took place, there were the two French managers, and there were some people who did manage to escape the bar. These hearings made it possible to establish the list of people who were present there at that meeting, and this list will make it possible to help identify all those there. These hearings also made it possible to explain the configuration of the bar and also the renovations that had been done and the capacity of this establishment. The follow-up investigation will look at the renovations done within the bar, the material that was used for these renovations, and the authorization for operations, and also what were the safety measures. I'm talking about fire extinguishers and other things to fight fire. The number of people present that evening, the number of people that the bar is allowed to have, that is its capacity, all the equipment, the exits, and the Forensics Institute of Zurich has been mandated, and according to the results obtained, and as measures will be taken during the investigation, there will be a possibility or not to examine whether or not there's any criminal responsibility involving people. And if it turns out to be the case, and if these people are still alive, there will then be an investigation on arson by negligence and homicide due through negligence and harm through negligence. With regard to the identification, there are many people who are working right now. We are talking about over 30 people who are working very hard to enable the families to know whether their loved ones, whether they are deceased or injured, and there will be a clear method explained by Lieutenant Colonel Bengen. Before concluding, I want to thank everyone, whether this came from the law enforcement agencies or the public ministry, and I want to especially thank all my prosecutor colleagues working on this case and all those who have expressed their availability to come and lend a hand. You understand the priority today is to identify the people so that people can begin grieving. I thank you, and I give the floor to Lieutenant Colonel Lengen. Thank you, Madam Attorney or Prosecutor General. I want to repeat once again, even if this has already been said several times, the Canton Police attach great importance to identifying all those who have lost their lives. This is extremely important, and we can use all the police forces, using the federal judicial police, different Swiss departments, and international colleagues. In this context, we have called upon a structure which is called the DVI. It's a Swiss structure. It is essentially used to identify victims of disasters. It has scientific, police, investigators, forensics experts, and dentists. And it is this structure which was used in 2004, when there was the tsunami and there were Swiss victims. So it works according to Interpol recommendations, because, of course, no mistake can be made, and we have to return to the families. The right remains. So the Valais police, with the federal minister's permission, as the prosecutor general has said, we are working with 30 people. They have been able to gather the remains and, according to an established protocol, have sent them where they have to go. And they are examining the bodies in order to be able to complete what we call the post-mortem file, which contains all the elements for identification which we find on the remains of the person. It could be digital. There could be objects on the person when they die. And these data will be compared with data that are ante-mortem, that had been collected from the family or close ones on the way people dress or things, objects that people could have had with them, but also DNA samples which are going to be compared subsequently. Once these two elements, ante-mortem and post-mortem, will have been obtained, a case is prepared and it is submitted to an identification commission, which is composed of forensics, the ministry relevant for this, and another body, and it will validate the correlation of the post-mortem and ante-mortem elements. Once the correlation has been made, it is validated by that very commission, which then submits it to the public ministry, which will release the body, and then there will be the death certificate, and we then can announce to the family the death, and we will continue operations. We now have legally the support of the civil registry, so that the families affected will not be alone. There will be inspectors from the judicial police who can help them get through these procedures from the civil registry. This is the procedure we have set up. For us, this is an absolute priority, but as you can understand, it is complete, and we have to be very meticulous. We cannot allow ourselves to make any mistakes in this area, even if this waiting period is extremely difficult to live through. That's why all our collaborators are working day and night in order, as soon as possible, to be able to provide answers to the families. Thank you.
Bonjour, mesdames, messieurs.
Good day, ladies and gentlemen. In terms of security, the Canton Valais can get support from the other cantons and from international support. There was an emergency situation. We had to save people, secure the area, and now we have to, as those who have spoken before me, the work goes on. And we had three priorities. There was accompanying the families, both the Swiss and the foreigners. Yesterday in Crans-Montana, families met them. We have the police surrounding them, accompanying them. This accompaniment is very important now, and when we announce two families, the identification of people. The families will be able to count on police accompaniment and support. It will not stop at the moment where we announce things. There will be psychological support and police officers to accompany them. Second priority, identification of the victims. I will not repeat what has been said. You will see that the canton can get a lot of assistance in order to put an end to this unbearable weight that has been weighing on people. And the third thing, this is establishing facts. As the prosecutor has said, much has been shown in the media. There are certain realities, and we then are investigating this through legal means in order to establish the reality of what happened. Within these three priorities, we have exceptional means that have been put at its disposal and unprecedented in the history of our canton. We have the Federal Office of the Police, we have 4 agents, federal agents, and we also have the Forensic Institute of Zurich, which is present in the work to analyze the facts and analyze the startup of this fire. We have 6 people from this institute here. We have some 40 police officers who are still present, and some of them are actually in this room. They're on the ground to welcome people, guide them, and make sure everyone's safe. We have some 40 inspectors conducting investigations and hearings, and added to that, we have about some 30 victim identification experts, such as forensic experts, doctors, and dentists. So we have dozens of people are showing that this is something that is extremely important for all of us, and we are counting on this federal solidarity. Institutionally, Valais is working with the foreign affairs departmental levels for we have hospital transfers that are a priority to treat as soon as possible and as best possible. And we know that in Sion, there is a lot of traffic, because air traffic, because there are flights to neighboring countries. Other countries are continuing to provide and propose their assistance. So there are many procedures that we can use within our confederation. There's the DFAE. We also have had Antonio Tajani, Italian foreign minister, who came, and we were able to reassure him and show him everything that's being done. And there will definitely be more state visits to come in the coming days, showing the cooperation that comes through human contact, and we will develop this cooperation as best we can. That is what I wanted to say with regard to safety and security. One last thing with regard to taking care of the people who are providing care and treatment, and also the responders. On the contrary, there were the first responders yesterday. We're also thinking about the people living in the neighborhood who helped. We're also thinking about the militia, healthcare workers, those working tirelessly within Switzerland and in Europe. And of course, we want to express all our gratitude to all of them. I conclude there. Ladies and gentlemen, representatives of the media, the event that we lived through yesterday and what we are still seeing is a great tragedy, and we want to express great support to the families and friends in the days to come. And for us, this is a very complex intervention, not just technically speaking, but also emotionally. It's been very difficult. And I want to express great thanks to all of our partners, as well as to all the OCVS responders. the 144 center, and also the responders on the ground. I want to just add some elements with regard to how the intervention yesterday took place. OCVS was alarmed the same time as the firefighters and the police of our canton. And we had some militia servicemen who were also brought to assist. And we also had to involve healthcare workers. And we have officials from the OCVS when there are disaster situations, and they have entire teams. Then the operations is not something specific just to our canton or to the OCVS, but it's what we do in Switzerland when the number of victims is greater than the means available locally. So first we have to get an overall picture of what's happening and set up an organization of the area where the disaster has taken place. And then we have to do what we call a pre-triage in terms of the seriousness of the injuries, and then these people are sent to the relevant medical posts set up. And that is where we have a medical triage, and there is therapeutic care and organization of transport to hospital structures. Treatments were to stabilize vital functions, to manage pain and intubate people, that is, to put them in, induce them into an artificial coma. Organization of orientation to hospitals means we had to see what the capacity of our emergency number 144 was. And I have to underline the great solidarity of all the hospitals who took patients. They were able to massively increase their capacity in very little time. And this information was then conveyed from 144 to another center where people could be attributed where there were means available and a hospital, a destination hospital. And then there were 41 ambulances, 22 of which came from the Vaud canton, which we would like to thank especially for this support. 13 helicopters, including 6 canton devices, 5 helicopters from Regen, and a helicopter from France, an Italian helicopter, and again, we would like to express to them as well our thanks. A command vehicle and some heavy trucks from the OCVS for disasters, and this is coming from Vaud. There were 150 healthcare workers who worked out throughout the night. Ambulance workers, medical doctors, officers from the OCVS, people from the DPMA, emergency psychologists, and first responders. Moreover, a significant number of emergency psychologists was set up, and this was under the OCVS's mandate, and this was set in motion to take care of those people who were involved, patients, loved ones, families, but also responders who were there on the ground, on site, or at the central locations. We had between 10 and 20 psychologists with continuous support adapted to the changing needs. That was yesterday. So how are things now? Well, things will change. The most gravely injured were evaluated, and this will take some time, maybe some weeks or months, and this continues. And this situation can be explained by 2 reasons. First of all, given the high number of injured people and the limited number of highly specialized places, patients were divided up into Swiss hospitals where there were intensive care units with beds, and not necessarily severe burning institutes. We wanted to stabilize their vital functions first. Secondly, there was a phenomenon of spontaneous hospitals. This is something we see in major incidents. It had been agreed, for example, that 7 patients would be taken to the hospital in Sion. In parallel, about 40 people went to the emergency at Sion with severe burns, which also needed to have very significant treatment. And this was done in coordination with the national network of CATAMAT, of national disasters, with the Emergency Coordination Response Center. And this took place yesterday with the OCS and relevant hospitals. In other words, we wanted to know what their needs were. There were burn assessments teams coming from France and Italy, supporting Swiss hospitals and helping coordinate transfer to those countries. You have to understand that here, this is taking place at a European level. These are standard procedures to take care of people with severe burns. During emergencies, as has been already said, most people will be transferred to neighboring hospitals, Germany, France, Italy, and Belgium. Other countries have also proposed their help. Air transport was proposed by Germany, Luxembourg, France, Italy. That's all I have to say.
Voilà, donc je vais vous donner quelques informations sur la situation à l'hôpital du Valais.
So now I'll give you some information about the situation at the hospital in Valais. We can say, first and foremost, that all the people working at the hospital are participating in the call to help, and they see the suffering within the families, and the families grieving, and also for the families, and especially those who are injured, who are living through a very difficult time. The hospital has been very strongly marked and affected by this, but the Valais Hospital has been able to rise to the challenge and function during this period. I will talk about our 2 hospital centers. We have the one in the Roman region and the one in the German-speaking region. Both have contributed to the healthcare provided. The one in the Romain region and in the Sion hospital, this hospital is specialized in treating people with severe injuries. So it was the appropriate situation for this disaster and emergency, and it has operated well. And it also must be known that this drama, and we have seen it, is taking place over the holidays. For emergency, this is always a very busy time. And we have increased the staff, and for the emergency services, we really have increased staff. So during the night of this drama, the emergency room was already very busy. So we had the injured coming in from this drama in Caen, and then we had the regular patients. No patient is ordinary, but those who had been injured, but in other circumstances. And the Sion team was able to react immediately from the very first calls. Everything was prepared. All the injured were taken care of. I will give you the figures at a later date, or at a later time, rather. And you also must know, and this has changed over time, as explained by Dr. Routan. We are now in a stabilization phase, and it must be said that this is a very delicate phase. It's one where families re-establish contact with these injured people, and the hospital is a place of confidentiality. We have to have calm for the patients. And I'm saying this because the media pressure that sometimes can be brought to bear on the patients can be a time of stigmatization. That's why we put certain limits, and I'm addressing you, the media, because many of you have tried to access the hospital. So we put some limits to protect the patients. This is a time of treatment that they need. Our patients need this, and the families as well.